Hi, I'm Greg Fell, I'm Director of Public Health. This is a brief update dated the 16th of August. So mostly today about the rules, significant changes of rules on isolation effective from today. And I'll try and explain. In short, people who've had 2 COVID vaccine doses and 14 days will no longer have to self-isolate if they come into contact with someone who's tested positive for the virus. They're a contact, so to speak. Instead, people will need to take a PCR test, and if negative, will not need to isolate, but if positive, you're a case and you do need to isolate. Whilst you're waiting for the PCR result, ideally you should self-isolate, but you're not required to by law. But it would be recommended that you do take other precautions, such as wearing a face covering in enclosed spaces, limiting contact with other people because you could turn into a case and be infectious, and especially contact with someone who's clinically extremely vulnerable. So it's a complex set of rule changes, and it will take us some time to get used to, and all of the key links will be at the end of the video. For those, this only applies to those who don't have symptoms. If you're a contact of a double vaccinated contact of a case and you have symptoms, then you still need to isolate. And you should still get a test. And where you can book a test from the website or call 119 and get a test kit sent home. So obviously then there's small print on this. So for the rule change to apply to you, you must not have symptoms. That would make you a case. And you must have had your second dose of an MHRA approved vaccine, those that have been given in this country, and 14 days. There are groups who are still required to self-isolate, and they include those who haven't received the COVID vaccination programme, those who haven't received both doses of COVID vaccination plus 14 days, those who have tested positive after a PCR test still need to isolate, and those displaying symptoms still need to isolate. So today's rule changes are clearly good news, nudges us back further towards getting back to normal, and are there because of the success of the vaccination programme. All that said, COVID is still around. Case rates are still pretty high in Sheffield and static, going down ever so slightly, but largely static. So we go into September and autumn with a pretty high case rate and some fairly significant pressure on the NHS and social care. All of the modelling predicts there'll be a further significant wave into the autumn, and that will make business as normal very difficult for the NHS and social care. So whilst the rule changes are welcome, we're still nowhere near out of the woods. There's still a very, very high case rate, and that is only going to get worse as we get further into autumn. Lastly, what we're seeing is that the vaccination programme still protects us significantly from serious illness, hospitalisation and death, and there's no doubt there. But particularly with the Delta variant, the vaccination programme isn't protecting us from being infected and infecting others as much as we had hoped it might. So we're still pushing that people get vaccinated as soon as possible, and if you have been fully vaccinated yet, please do so. So on vaccinations, as well as over 18s who've been eligible for a vaccination for some time now, that eligibility has now been extended to all 16 and 17-year-olds. Having a first jab by the 23rd of August means that there's 2 weeks for people to build up immunity before the new term gets underway. Of course, and that is important. So it's important that you get the jab as sooner rather than later. As with adults, you can book the jab online via the National Booking Service, or you can walk in with no appointment at the Sheffield NHS Vaccination Centre on Longley Lane, 8 till 5, Monday to Sunday. No ID is required to receive the vaccine, and actually there's no need to be registered with a GP to receive the vaccine, which is obviously good news. There are lots and lots of other options available to get vaccinated within Sheffield, with walk-ups and pop-ups all over the city. The Octagon Centre is no longer open for walk-ups, but as I say, they are available at Longley Lane, and you can do so without an appointment. Vaccination numbers are still going up, but the rate in which they're going up is slowing down. there are still many thousands of people who are eligible that haven't yet taken up the offer of the vaccination programme, and there are still many thousands who haven't yet had their second dose. So you're not fully protected until you've had 2 doses, so please book an appointment today or walk into one of our pop-up clinics all over the city. So one change on the testing programme that you may or may not have noticed, but there are different types of lateral flow device tests. Before you had to swab both your throat and your nose. However, there are some new tests coming onto the market, and it's a nasal swab only, and the waiting times are different. So in short, if you receive a box of lateral flow device tests that look different to the usual box that you've been seeing, read the instructions. And it's important that you do get tested, even if you're fully vaccinated and you're mixing with people outside your household. You should still be testing twice a week with a lateral flow device test.